used our services. Right now in Florida, I think we are in about 440 different communities. We even go to some 55 and over communities. My boss, Ray, realized that there was a need for dermatology in community settings, because some people don't have family members that can take the time off to bring them to different appointments, and sometimes the residents, as you're tired, you don't want to have to go to 10 offices a day. So he kind of developed this in 2005, so we've been around for 20 years. We are a full service dermatology practice that provides dermatology care to senior communities. Quality and convenient dermatology service is right to you. Specializing in the prevention, detection, and treatment of precancerous and cancerous growths, as well as dermatological conditions you may have. So sometimes when you think about dermatology, you just think that you might have a mole that needs to be removed or a mole that needs to be looked at. We can also help with rashes. If you're sitting outside and the breeze blows and you get poison, we can help with poison. We can help with precancerous lesions. Some of those that are kind of crusty that might appear, sometimes they will benefit from cryotherapy, which is just liquid nitrogen. It's very pinpointed to that area. Some people say freeze it off, some people say burn it off. In actuality, it's just liquid nitrogen and it kind of freezes the area. Sometimes they're a little stubborn and they need a little bit of extra treatment, so you might need another shot of that liquid nitrogen in a couple of months. But that is considered an AK, and those are considered precancerous. Here's what we can help with, of course. Dermatitis, eczema, psoriasis, scabies, cysts, ulcers, warts, skin tags, skin infection, keratosis, and rosacea are just some of the things that we can help you address. The skin is the largest and most visible organ in the body. Everyone should take time to learn how to detect skin cancer on themselves and loved ones. This is true. This is something that we've kind of taken for granted as we, go through life. I'm 49. I'm very open about how old I am, but I can remember my best friend and I sitting out with baby oil, just trying to get a suntan. And now that I'm in this industry, I'm like, oh my gosh, what were we thinking? And then it's funny because I've been in medicine for 20 years. I started with a plastic surgeon and he taught me all about skincare 20 years ago. So when I see people and they're like, oh, you look great for your age. And I'm like, well, I don't smoke and I use sunscreen religiously. Actually, I spilled some on myself today. So that's from me putting my sunscreen on this morning. Mature skin and changes. Aging causes changes at every level of the skin. Skin problems tend to be higher in seniors than in any other group. So new studies have found that someone that's over the age of 65, your chances of developing a skin cancer increase by about 45%. The epidermis is the outer layer that does not recover as rapidly. The outermost layer of the epidermis loses lipids, fat-like substances, making the skin drier. The dermis is the skin's inner layer, loses collagen and elastic tissue that keeps the skin plump and protects against injury. You'll realize as we age, if you're walking down a hall and you bump your hand on the door, yeah, you're gonna get a bruise. Yeah, that's because our skins are aging. Maintaining a healthy skin for a healthy lifestyle, eating healthy, exercising, hydration, washing your skin gently, moisturizing regularly, and protecting yourself from sun. This is probably my 15th presentation that I did, and one of the biggest questions I get from this demographics is how do I help with dry skin? The trick to treating dry skin is as soon as you get out of the shower, or if you have someone help you, apply your moisturizer on damp skin. You never want to be completely dry and then put your lotion on, because it doesn't absorb as well as it does if your skin's still a little damp. I'm from Maryland, so during the winter months, I would take off my pants and you could see just dry skin. It's not cute and it's uncomfortable because it can be itchy. So just apply your moisturizer when your skin is still damp. Eating healthy also can help with your skin. Foods rich in vitamin A, C, D, and E. Dark oranges and dark green foods, almond nuts, I don't even know how to say that, soy foods, and eating fish 2 times a week helps. There's a lot of properties in fish that help your overall health. But it does, the oil in the fish absolutely helps your skin. Flush out toxins, hydrate to get that glow. Hydration eliminates sunken eyes, helps in digestion, maintain muscle tone, prevent muscle cramping. Exercise, stay active. When you are up and you're moving, your body circulating, that also helps your skin kind of stay plump and keeps your oxygen moving throughout your body. It improves circulation and blood flow. When you have restricted blood flow in an area, your skin can kind of bruise, it can get puffy, you can get an indentation from it just not being hydrated enough. Washing your skin. Skin is naturally drier in older adults. Treat skin gently. Wash with warm water. Avoid strong soaps, no perfume or deodorant soaps. Immediately moisturize after bathing. As a woman, we all love to smell good. I understand that completely, but it's so bad for our skin. We do recommend something soft that you wash your face with. CeraVe, Dove, but you always want something that doesn't have any perfume. You don't want to buy Dial antibacterial and wash your face with it. It's just not a good thing. So something soft on your skin that doesn't contain harsh perfumes and deodorants. Another way that you can kind of help your skin is be the same way with your detergents. All free and clear makes a really good version that doesn't have all of the scents. If you're sensitive to scents, you want to go that route anyway. Protecting yourself from the sun. Avoid sun during the highest intensity hours, and I think that's 11 a.m. to 2 p.m. is when the sun is the highest. Wear protective clothing, example sunglasses and a hat. Use sunscreen. You want to do self-examinations and have a full body scan at least once a year, twice a year for seniors. We do not recommend getting vitamin D for sun exposure. Ultraviolet radiation from the sun can lead to the development of skin cancer. Vitamin D from foods and dietary supplements offer the same benefits. This young lady up here on the front, if you'll look at her beautiful shirt, her shirt is a UV shirt. That means she can wear that shirt outside and she is going to be protected from the UV rays. If you see Mr. Don, he wears a hat every day because he has had some issues on his scalp with melanomas and different cancers, so he wears a hat. You guys might not be able to tell, but I have androgenetic alopecia, so I have very thin hair on the top of my head. I wear a hat all of the time. If I'm outside, if I'm walking to my mailbox, I just have a ball cap on. If I'm at the pool or if I'm at the beach, I have a wide brim hat every single time. And I never leave my house without sunglasses. 3 of us drive in my home, and I have 3 pairs of sunglasses in each car just because I have to protect my eyes. Effects of excessive sun exposure: sunburn, eye damage, drug reaction, permanent destruction of the skin supporting structure, precancerous lesions, and skin cancer. Oftentimes people don't realize that the medications that you're on, if you're not mindful and actually read the bottle, will say avoid the sun. There are a lot of medications that if you go into the sun have an adverse reaction. You could get blotchy, you could get the hives, you could become lightheaded. You could even get like blisters from the sun on certain meds. So before you go outside or you want to sit outside in the sun, I would sit here all day long if I could. You want to wear sunscreen and make sure the medications that you're on, that there's no warning label about the interactions from the UV rays and the prescription drugs that you're on. I've seen this picture forever. 20 years this picture has been around. I would love to know the origins of it because it's been around forever. This man was a truck driver, and if you could see, the left side of his face is the side that was chronically exposed to the sun. He probably didn't wear sunscreen, and he probably didn't have his windows tinted. This is the side that wasn't exposed to the sun. You can see the difference. This young lady here looks like she has red hair. She's probably more fair, and she has what you think are just freckles. However, when you look at it under a specific light that a lot of dermatologists use, you can see this sun damage. All of these spots that you would think were freckles is actually sun damage. I'm gonna share, I recently had my full body scan back home with my dermatologist, And because I'm here, I still wear sunscreen all the time, but I've noticed in 4 months that I've gotten more freckly. And it's sun damage, and I use sunscreen, so it does happen. And she noticed, because I used to work for her, she said, V, you haven't always been that freckly. She's like, so just keep that in mind. So even with proper sunscreen, you can still kind of get that damage, so you just want to be mindful about your time out in the sun. Skin cancer is the most common form of cancer in the United States. More than 5.5 million skin cancers are diagnosed yearly. 1 in 5 Americans will develop skin cancer. The odds of developing skin cancers rise as you age. Between 40 to 50% of people over 65 will have at least one skin cancer. Pre-cancer, we call these AKs. So the AKs are highly treatable. That's what we would look at. You would say it itches or it's crusty. We would shoot it with some liquid nitrogen and kind of treat it that way. They're easy to treat. That's a precancerous cell. After that, it's basal cell, squamous cell, and then malignant melanoma. I'm going to give you some examples. AKs. It's estimated that 58 million Americans are affected by AKs. Typically appears to sun-exposed areas: face, bald head, lips, scalp, and the back of hands. I've also seen it on people's ears and their back of their necks, whatever area is exposed to a lot of sun. Again, these are the ones that can be treated fairly easy. This is just kind of an example of what to look for when you're looking at an AK. Basal cell carcinoma, more than 4.3 million cases diagnosed every year. Most common form of skin cancers. 80% of new skin cancer cases is a basal cell, mostly found to sun-exposed areas: face, arms, head, back of the neck. Usually do not spread. Does not spread. But this is before. If you have a basal cell and it doesn't get treated, then it can turn into a squamous cell, and squamous cell is a skin cancer that can metastasize. This is just a couple of examples of what a basal cell looks like. It bleeds, oozes, crusts, and remains open for a few weeks, only to heal up and then bleed again. Sometimes you'll bump your hand and you'll think it's just a little bump, and it'll bleed and it'll heal up, but then you look a couple of days later and you're like, a couple of weeks later, I haven't hit it and it's still bleeding. That's something you want to get looked at. I know. Sometimes it could be a patch of crust that may also itch or hurt. Other times it's persistent with no discomfort. Sometimes you might not even know.
Can you hear her?
Yes.
Do I need to be louder?
We're having a hard time hearing her.
I can't hear you.
You can't? Okay, I can come over here. Ooh, it can also look like a scar. And this is just the basal cell carcinoma. You just kind of want to be mindful of. Here's just some other images. It can be a shiny bump or nodule. The bump can be pearly, clear, or pink, red, white. It can be any color. It can be confused with a normal mole. So a lot of people have normal moles. They just might be raised. That's something you just want to get looked at. So that's your baseline. I have a couple of myself. I know what they look like. They haven't changed. They don't bleed. They don't itch. You kind of know your body, but you also might know your spouse and kind of be mindful of those kinds of things. If you ever question something, it doesn't hurt to just make an appointment. Your insurance is going to cover it, and it could save your life. Squamous cell. More than 1 million cases are diagnosed every year in the U.S., most likely develop on top of a scar or previous skin injury. Squamous cell carcinoma develop from untreated AKs. They're the ones that I talked about a couple of minutes ago that are highly treatable, that we would come in and shoot with liquid nitrogen and freeze it off. If they don't get treated, it can eventually turn into squamous cell. Keep in mind that squamous cell is one of the cancers that can metastasize. There's a 90% cure rate when caught early. This is just some examples of what a squamous cell looks like. A wart-like growth that crusts and occasionally bleeds. That's where people get confused, because a lot of them bleed. An AK can bleed, basal cell can bleed. So it's just really important to be mindful of how fast it's healing. And then again, if you have any questions, make an appointment. I don't care if it's with us. You might have a dermatologist that you like. That's fine. I just really want you guys to get treated with something that could be preventable. You didn't miss much.
Oh, the oral surgeon. So is not one doctor, it's another doctor?
that comes.
Meaning a
Oh, yes.
dermatologist versus
Yes,
oral surgeon.
yes, and
Yeah.
then you have a dentist and you have an oral surgeon,
Yeah,
yep,
everything.
I'm very familiar, yeah, I gotcha. This is just some examples of the squamous cells. Sometimes the squamous cell will be elevated, so you'll have an area on your skin where it's a little bit higher up than what the skin is, like you can actually feel a bump, and it might be have like a little cave, it might be a little concave, or it could be protruding. It can be scaly patches, have irregular, we use the word ugly or angry borders, this kind of like a better example to explain to people when you say it looks ugly or irritated, that's what you wanna look for. Malignant melanoma. More than 178,000 cases are diagnosed yearly. This is the most deadly form of skin cancer. About 2 people every hour die in the US from melanoma. Melanoma will metastasize if not treated early. So that statistic is from somebody that had a melanoma that just didn't realize that they had the melanoma, and it metastasized and it gets into the lymph nodes, and melanoma can attack other organs. On average, a person's risk for melanoma doubles if he or she has had more than 5 sunburns in their lifetime. Yeah. It's responsible for 75% of skin cancer deaths. 1 in 50 people will develop a melanoma in their lifetime. If detected early enough, malignant melanoma is highly curable. I've been given permission to share this story. Excuse me.
So do the Irish have more melanomas than other?
Not necessarily, but people that are fair complected, your chances are a little bit higher. You just want to be mindful. I'm not a doctor. I don't pretend to be. I just have been very fortunate in my career to work with a lot of doctors that have taught me a lot. Last summer, my girlfriend and I were walking, we bartended together. We were walking from the beer cooler back to take the beer to the bar. And I said, hey, put the beer down real quick. And she was like, why? And I sat her down and I pulled my pen out, and she had a little bump. And I can show you guys in my cell phone. I'm gonna eventually incorporate it into my slides because she gave me permission. 49 years old, she had a bump, she had a spot on the back of her shin. She would have never seen it. It looked like a freckle. It wasn't raised, it didn't itch, it didn't bleed. None of the characteristics that you would think. And I circled as like, I don't like the way that looks. She's like, really, Dee? And I was like, then I took my camera and my light and I took a picture. I was like, Chrissy, it's very dark. I knew all of the things, and I'll show you at the end. She got in with the dermatologist that I worked for. They biopsied it. It was melanoma. She would have never known. She went to the plastic surgeon in Maryland, and he told her that I probably saved her life. It was that undetectable. No, it just looked like a freckle. And she worshiped the sun. Like, she loved always at the beach, so it kind of like goes hand in hand. And I told her, I was like, you love the sun like this, we need to get this looked at. So now she calls me, she's like, what should I wear? What kind of sunscreen? What kind of hat? And it scared her, but had I not been trained and paid attention, could have went bad. ABCs of melanoma. When I got into medicine 20 years ago, it was the ABCs of melanoma. In the last 20 years, they've added D and E. So you want to look at this asymmetry of a lesion. If it's symmetrical, if I cut this in half and fold it, it's going to look the same. That's where the symmetry is. Borders are even. There's no oblongness here. It does look very consistent. One color. There are no additional colors. It does look just like it's a red area. It's small. I don't know if I'd be mindful of all sizes, but evolving was added recently. We've noticed over the past 10 years, 20 years that skin cancers, even precancerous cells, will kind of evolve over time if not caught. So you just want to be mindful of anything that's changing. If you have a mole and you've had it for 20 years and now all of a sudden it starts bleeding, or you notice that it got a dark spot, you want to get it looked at. This is melanoma. If you can see, it's completely asymmetrical. It's all over the place. If I cut this in half, it's not going to fold and look even. Borders are uneven. See how it's kind of jagged and all over the place? multiple colors. That's how I found that melanoma in Christy. It was dark in the center and it looked probably like that. So you see how it's multiple colors? It's a dark red, even like almost a black here, and then lighter, larger than a 1/4 inch, and then it changed. So this person went from this to this and it became melanoma. There's just some other examples of melanoma. Treatments. This is what we offer here, that we can come, when we come here, we can do cryotherapy, topicals, ED and C. If there is a lesion that you don't like or that the provider's looking at and they don't like, they're gonna communicate that with you and they're gonna do a biopsy. They'll quickly numb the area and then they'll do a couple layers of the dermis with a, I don't wanna get into it because it's scary to people, but they just cut it off. They'll send that for pathology. Then she will take electrocautery machine that she'll plug into your wall and just cauterize it so it stops bleeding. So there's no real maintenance or no real care that you have to do after, just change the bandage. Surgical excisions and Mohs surgery can be treated if you have cancerous lesions. Did you do this? Oh yeah. So we cannot do large surgical excisions. So if we do find out that it's skin cancer when we do the biopsy, we then would have to send you to a Mohs surgeon. That is not something that can be done in-house. You wouldn't want that to be done in-house. Mohs surgery can take a couple of hours. Mr. Don can probably tell you. Mohs surgery is very intense. They take the biopsy, they literally take it back to a lab. They look at it under a microscope. They might need, it's layer by layer by layer by layer. So most Mohs surgeons will schedule you for an appointment and they'll tell you you could be there for 1 hour, you could be there for 6 hours. We would have to refer you out for that. Examine your skin on a regular basis, ask your dermatologist about any suspicious changes or in moles or any area on your body, and do everything in your power to protect your skin from the sun rays. I like sharing real life stories because I feel like it helps bring it home. I work for a general surgeon. One of the girls that I did a lot of work with, when I sent our mammograms and any imaging, I sent it directly to her. She would get my patient scheduled. She called me one day and she said, my husband has a nodule on his thyroid. Can Dr. Kumar do the surgery? And I was like, yeah. I was like, I'm not gonna make him come in. I went to my doctor and I was like, Doc, Beth's husband has a nodule on his thyroid. I'm just gonna put him in for surgery. We're gonna do it at Carroll. Perfect. Did the biopsy at the hospital. Can't do that in a surgery center. 2 weeks later, I got the pathology. I was always in charge of distributing the pathology. It was melanoma in his thyroid. Never had one issue. They think that he probably had a mole that went undetected, and it could have been in between his toes. It could have been in between his, backside that went undetected, and because it went undetected for so long, it didn't start morphing. It probably got reabsorbed into his body and caused melanoma in his thyroid. He was maybe 50. He passed away not long after that.
Gosh.
Yeah. And this is something that is highly treatable and preventable. You just need to get seen by your dermatologist. This is not fear mongering. This is just education purposes. If you need to make an appointment, every month we will have a sign-up sheet. You can talk to Don, or I'm so sorry, what was your name again? Sharon. That they can help you get scheduled. Or those of you that are kind of independent living, if you just want to call on your own, you could call that number. When we get you on the phone, we will just need basic information. Name, we call it demographics, name, telephone number, date of birth, and your insurance. We can verify your insurance real time so that you know when we hang up that call if we're going to participate with your insurance. We accept many plans. There might be a one-off plan that we don't necessarily accept, and we will let you know that as well. If we see you and we have to do a biopsy and it does come back as a cancer, we will help you facilitate getting a Mohs surgeon. Some of you might already have one. I think Mr. Don is probably an expert in that field, so he could probably refer you to his, but we would help you take those necessary steps to get that scheduled as well.